Hi there, my name is Rupali Neemachwala. I'm a physiotherapist and co-founder of Rehab Academy and Progressive Rehab. I teach vestibular courses and have been managing dizzy patients for over 20 years. Today I will show you how to perform the HINTS Plus test, which is a test to distinguish a peripheral vestibular issue like neuritis from a central cause like a stroke or a brainstem problem. HINTS stands for Head Impulse, Nystagmus, Test of Skew. It's a 3-part bedside exam used when the patient has sudden, constant dizziness or vertigo. Research shows that the HINTS Plus exam, when done properly, is undeniably 200% more sensitive than an early MRI for detecting posterior circulation stroke in acute vertigo. The plus in the HINTS was added to increase the diagnostic accuracy, and it includes subjective questions and a hearing test, which I've never seen with vestibular neuritis and much more common for a serious central pathology. The subjective features include severe headache or neck pain, focal paresthesias or weakness, any of the 5 Ds, obviously not the dizziness, diplopia, dysarthria, dysphonia, dysmetria, or dysphagia. Dizziness is the only D that our peripheral patients can have. New ability to walk without aid, vertical nystagmus in room light, or sudden onset of new hearing loss. The test of hearing is done by rubbing your fingers close to the patient's ears of the client and assess if there's any change in the ear. You want to do it to both the ears. The first part of the test is to evaluate for nystagmus. Have the client sitting with their eyes open. Clinician observes for any spontaneous nystagmus in room light. If you don't see any nystagmus, you ask the person to look towards the blank page. By doing this, you will take away the fixation and you might see a little bit of the nystagmus. And then you can ask them to do the same without turning your head, just to the other side. Right? Assuming I did see a beating nystagmus towards this side, then I'm going to do a gaze evoke test, where I'm just going to ask and hold it about 30 degrees and look for the beating here. If there's any change in the nystagmus, the nature of nystagmus, then I take them over here, look for any change again in that beating of the eye or nystagmus. I go up, don't move your head, just with your eyes. And then you go down and you look for that. So for the down, you can also have their eyes open like this, so you can look what's happening and bring it up. This was the test for nystagmus. For a peripheral problem, you would see a nystagmus that could be horizontal in case of neuritis. However, it would not change with gaze. It would not change direction. For a central nystagmus, you could see a vertical, that is upbeating or downbeating nystagmus, or you could see a horizontal nystagmus, but that would change every time I move the finger. So if I move the finger to the right, it would beat to the right. If I move the finger up, it could start beating up or down. So changing direction nystagmus is a central problem. The second part of HINTS is the test of Skew. Here we do the cover and the uncover test. Patient is sitting with their eyes open. We can use either a hand or a probe like this, and all we're going to do is ask the patient to look at my nose. While they are fixating, I quickly cover their eyes, stay there for about 5 seconds, and I uncover. And then I do the same to the other eye. I quickly cover the eyes and I uncover. I'm going to do this a few times, and what I'm looking at is if there's any vertical or diagonal shift of the uncovered eye. If that is the case, then that is what the brain is trying to do to adjust for that problem, which is again a central problem. Any diagonal or vertical misalignment is a central problem. A normal test, there will be no movement of the eyes. The third part of the HINTS is the head impulse test, HIT. The clinician stands in front of the patient. You tilt their head about 30 degrees in deflection, and you slowly turn their head. I'm going to ask you to keep looking at my nose as I do that. So I'm going to slowly turn your neck and then I'm going to give it a quick jerk within 20 to 30 rotation degrees. Okay? You have to keep looking at my nose and keep your eyes open. And what we're looking for is the patient is able to maintain his gaze as I do that. If the eye stays fixated on the examiner's nose or there's no catch-up saccade, then it's indicative of a central problem. You have now successfully completed the HINTS Plus test. Please remember that these tests are for educational purposes only, and to make sure you're performing them correctly and for the right condition, visit rehabacademy.ca for our next course on mastering BPPV, BVL, and UVL. Happy treating!